Picture this. It's the winter of 1918. The world is tearing itself apart in the last brutal moments of the First World War. But while soldiers are training in the bitter cold, a whole new kind of enemy is about to step onto the world stage. An enemy nobody can see.
And that's not an exaggeration, not even close. In just a matter of months, this new threat would sweep across the entire globe, killing more people than all the bullets and bombs of the Great War combined. It was a terror that made even the battlefields look tame.
So where does our story kick off? Not on some muddy battlefield in Europe, but in, of all places, Kansas. Camp Funston, March 1918. Thousands of young guys are getting ready to go to war. Then, a camp cook gets sick, then a sergeant. By lunchtime, more than 100 soldiers are down with a wicked fever and a nasty cough. At the time, it just seemed like a bad case of the flu.
What's absolutely mind-boggling is just how fast this thing moved. Winning the war was priority number one, right? So 6 soldiers were crammed onto transport ships heading for Europe with zero thought about quarantine. Those ships basically became floating petri dishes. And every time a new wave of American troops landed in France, the virus landed right along with them.
Now, you've definitely heard it called the Spanish flu. But here's the thing, that name is totally misleading. See, countries at war like Britain, France, Germany, the US, they were censoring all bad news to keep morale up. But Spain was neutral. Their press was free. So they were the first ones to report, hey, there's a huge epidemic going on. Even their king was sick. And because they talked about it, the name just stuck.
Yet let's be super clear on this. It did not start in Spain. The name was just an accident of wartime politics, and which newspapers were actually allowed to print the truth. The virus was already raging on both sides of the trenches long before anyone started calling it Spanish.
Okay, so by the summer of 1918, something weird happened. The flu cases started to drop off. The war was starting to turn in the Allies' favor. People thought, phew, okay, maybe the worst is over. Some papers were even joking about it. They had no idea what was coming.
And this is where the story takes a terrifying turn. During that quiet summer, the virus hadn't gone away. Oh no, it was changing, mutating. The version that was about to be unleashed was way more vicious than what anyone had seen in the spring. A second wave was building, and it was going to be a tsunami.
Just listen to this account from a U.S. Army doctor. He talked about something called cyanosis. It's where patients weren't getting enough oxygen, and their skin would turn so dark blue that it became hard to tell white soldiers from black soldiers. This wasn't your normal flu. This thing was a monster.
What really freaked out the doctors was who it was killing. Flu is supposed to be most dangerous for little kids and the elderly, right? With this strain, flipped the script. It targeted young, healthy adults, the strongest people in the prime of their lives. And science had nothing. Doctors felt completely powerless against it.
So, after this mutated virus sharpened its claws in the crowded army camps, it broke out. It escaped the war and spilled into the civilian world, everywhere. It spread to every continent, turning vibrant cities into ghost towns, seemingly overnight. If you want a truly heartbreaking example of this, look at Philadelphia. The city decided to hold a massive parade to raise money for the war. 200,000 people jammed the streets. It was a public health nightmare. Within days, the hospitals were completely full. They had carts going through the streets just to pick up the bodies left on the sidewalks.
And Philadelphia was just one story. When you zoom out, the sheer scale of it is just hard to process. In British India alone, an estimated 20 million people died. Trains would pull into stations full of the dead. Across Africa, the very railways that had been built for colonial trade became superhighways for the virus, with devastating results.
It's easy to get numb to numbers that big. But behind every single death was a story like this one. A family, wiped out in days. This wasn't just a disease that killed people. It shattered the very fabric of families and communities all over the world.
And then, on November 11th, 1918, it happened. The war was over. The world just exploded with joy and relief. People poured into the streets to hug, kiss, and celebrate the end of 4 long years of slaughter. But the virus, well, the virus didn't sign the armistice.
And here's the most tragic irony of all. Those massive, joyous celebrations for peace, they were the absolute perfect environment for the virus to spread. All that close contact kicked off a whole new third wave that would reach even the most isolated corners of the globe.
The voyage of one single ship, the SS Toulon, shows you exactly how this happened. It sailed from New Zealand through the Pacific, basically acting as a plague ship. It got the virus to islands that had been completely safe up until that point, and in places like Western Samoa, the result was absolutely catastrophic.
But check this out. It's an incredible real-world experiment. Western Samoa, where the ship docked, lost 1/5 of its entire population. 1 in 5 people, gone. Right next door, American Samoa made a different call. Their governor enforced a strict quarantine. No ships allowed to dock. Their death toll? 0. Not a single person died. A simple, decisive action saved an entire population.
By 1919, the pandemic finally started to burn out. But the world it left behind was scarred beyond recognition. Humanity had survived, but the cost of that survival was almost too high to bear.
So what was the final tally? The estimated global death toll is 50 million people. Let that sink in. 50 million. That's more than twice the number of people who died in the entire First World War. And here is the most sobering fact of all. We didn't beat the virus with some brilliant medical breakthrough. There were no vaccines, no miracle drugs. The pandemic ended because it had burned through so much of the human population that it literally started to run out of new people to infect. We reached herd immunity, but we paid for it with millions and millions of lives.
So you can't really call it a victory, can you? It was more like we just survived. The virus was never truly wiped out. It just faded into the background, a constant reminder of how fragile our world really is. And it makes you ask a pretty big question. Are the lessons from 1918 something we're willing to remember or doomed to forget?